Let's talk about healthcare. ACA versus trumpcare. By late 2016, the Department of Health and Human Services announced 20 million people were newly covered by health insurance as a result of Obamacare. The Congressional Budget Office's analysis of the TrumpCare plan estimates that 22 to 23 million fewer people would have health care insurance over the next decade.
Hi, Jamie, what do you think of the health care proposed under Donald Trump?
Well, I've had a pre-existing condition since I was about 11 years old, and I am extremely disturbed and concerned that he will take away coverage for people like me who have pre-existing conditions.
Thank you.
Before Obamacare, pre-existing conditions that cost people coverage or led to very high premiums included pregnancy, diabetes, heart disease, genetic conditions, injuries, epilepsy, cancer, mental disorders. The percentage of Americans with a pre-existing condition is approximately 53%.
Hi, can you tell me how you fared under TrumpCare?
I haven't fared well under TrumpCare. Before he was elected, when I was under Obamacare, I had no out-of-pocket expense and minimal deductible. Now, to get my toe fixed that hurts every single step I take is now $4,000 out of pocket, which I cannot afford. My son's deductible as well is $4,000 per year. And in addition, we have our monthly premium has quadrupled. That is still affordable, and I can afford that. But for other people that it was already at their max, I don't know how they're going to make it. And I'm just suffering with my toe. There are many people who suffer way more than I, and I know that that's not a critical thing. As my mother said, it's far from my heart. So I just shut up and take it. But I'm sure going to vote November 6th.
Thank you, Gina.
Women, low-income people, and the elderly will all feel the effects of the American Health Care Act.
What do you think of the proposed health care under Trump?
Well, I believe that we're at great risk because of this. It's an unstable and not well thought out system. It has no groundwork that's going to be to our advantage. And I might weather my way through it. I sort of know what I'm doing, but there are millions of people who are going to suffer because of this.
400,000 women would lose access to preventative care, and up to 650,000 would have reduced preventative care within the year if Medicaid patients could not receive Planned Parenthood services. The House GOP health care plan also benefit younger Americans more than older Americans. The phasing out of Medicaid expansion would hurt Americans with mental illnesses and substance abuse disorders. Spending by Medicaid made up 25% of total mental health spending and 21% of spending on treatment for substance abuse disorders in 2014, according to the National Council for Behavioral Health. Low-income and chronically sick people will suffer. Through introducing massive cuts to Medicaid and allowing insurers to add a 30% surcharge to premiums if people go without insurance for too long, the House Republicans' plan will also hurt low-income Americans, especially if they have chronic diseases.
Hi, Alan. What do you think about the proposed health care under Donald Trump?
Donald Trump doesn't actually have a health care program. Donald Trump has a let's destroy anything that Obama did program. Now, if Obama had created apple pies, Trump would be trying to get us to spit them all up. What the Republicans are doing, because let's be clear, it's Congress that does this. Del Delgado is running for Congress, not the president. What Republicans are doing is just trying to tear up the health care program any way they can, and that bumps people off of their insurance. ditching preconceived conditions is awful. The more we know about medicine, the more everybody has a preconceived condition. So nowadays, there are two kinds of people: people who have preconceived conditions and people who don't know they have preconceived conditions.